Guys, have you ever had your testosterone levels checked? You've maybe seen two numbers, your total testosterone and your free testosterone. What do these numbers mean? What's the difference? I'm Dr. Justin Houman, board certified urologist and men's health specialist, and I'm here to talk to you about free testosterone versus total testosterone, what's important and what's not. Total testosterone is comprised of your bound, which is connected to a protein called sex hormone binding globulin, plus your unbound, which is your free or bioavailable testosterone. Your free testosterone is your unbound or bioavailable testosterone. That's the testosterone that has an impact at the cellular level for your brain, your muscles, every part of your body that can make a positive impact. That's about 1 to 3% of the total testosterone in your body is free or bioavailable. Think of it as total testosterone as your bank accounts, your investments, your assets, everything you're worth, whereas your free testosterone is the cash that you have in your wallet, the money that you're able to use today. So why can these numbers be misleading? The total testosterone is the main screening test that we use for diagnosing somebody with low testosterone. So if a patient comes in, he has fatigue, low energy, sexual performance issues, we draw a blood test and we look at that total testosterone level. If that total testosterone level looks good and it's normal in the normal range and a patient is experiencing low testosterone symptoms, many doctors, primary care doctors, endocrinologists, even some urologists will be like, well, that doesn't seem to be correlated because your total testosterone numbers are good. But that is misleading because it's not your total testosterone that's so important. Your sex hormone binding globulin is important, but more importantly, your free testosterone levels are the most important. So if you have a high sex hormone binding globulin with a normal testosterone, that can lead to a low free testosterone, which is why you're symptomatic from having low free testosterone levels. So as a result of that, we do have to make sure that we're checking your free testosterone levels because that could be quite indicative of the symptoms of low testosterone that you are experiencing. We even have studies that when they compare total testosterone to free testosterone, the free testosterone level correlates more and better with your low testosterone symptoms than the total testosterone levels. So free testosterone is a very, very important part of what we do when we are screening patients for low testosterone. Which tests to order and when. So a lot of guys will come to me with a total testosterone level that their primary care doctor checked, and it shows a normal testosterone level, but they are experiencing symptoms. At that point, what I would do is I check a free testosterone level on them. Primarily, the key thing here is we want to check it before 10 a.m. Not just one time, but twice, separated by a few weeks, just to make sure we have 2 data points in order to make the right decision. So that's the key thing. You want to check before 10 a.m. You want to check a free testosterone because that will give us the most data and the best data to make the accurate decision going forward. One thing I can't stress enough is symptoms versus the numbers. Ultimately, you do not want to treat the number, you want to treat the symptom. So many times guys will have normal testosterone levels, but they have symptoms. So a normal total testosterone with a low free testosterone and them having symptoms, that would indicate some form of treatment. There are even some scenarios where a patient will have normal testosterone levels, total T, but they'll have normal free testosterone on the low end of normal, but they will still have symptoms. In those situations, again, you want to treat the patient. You don't want to treat the number, you want to treat the patient. The big thing here is when we think of testosterone levels, it's a very wide range. For total testosterone, we're saying anywhere from 300 to 1,000. That's a very wide range. My testosterone levels may be in the 400 or 500s, whereas an NFL player, he resides in the 800 to 900s. So it's unfair to compare and say everybody needs to have a similar testosterone level. So ultimately, you want to treat the symptoms, not so much the numbers. The clinical decision making when it comes to treating low testosterone levels or low total testosterone levels and low free testosterone levels requires shared decision making with the patient. So we talk to the patient about their symptoms, what's going on, how they're feeling, and ultimately we want to make a decision on how to proceed. A very important fact here and very important point is testosterone replacement therapy will suppress your body's natural ability to produce sperm, and you lose your fertility potential as a result of that. So that's a very important point. If you are experiencing low testosterone and you want to boost this, you want to discuss with your physician about your fertility, and you want to let them know and if you're trying to have kids anytime now or in the future, because that could help dictate what medications you're using. More importantly, it could even dictate you banking some sperm before you get on testosterone replacement therapy. So make sure you ask that question. Both total testosterone and free testosterone are both very important in creating the whole story of what testosterone is in your body. Total testosterone is the starting point. Free testosterone is really the plot of it. So making sure you get both those numbers gives us a sense of what's going on. That will ultimately help us diagnose and treat you appropriately. But again, remember, if you are struggling with low testosterone symptoms, don't just ask for a total testosterone. Ask for the free testosterone and a sex hormone binding globulin level, as that will give us the whole picture in terms of what's going on and will give us a better sense of how to treat this.